My name is Tanya Nazemi. I am a urologist here at Swedish, and I am here to discuss the urologic causes of pelvic pain. I'll start by saying I've really enjoyed listening to all of the talks today. I've actually learned quite a bit, and some of what I will discuss today will actually reinforce some of the topics that have already been discussed. So my goals are to discuss the common clinical presentations of pelvic pain in relation to the urinary tract that we see in our practice, as well as the differential diagnoses, evaluation and testing that can be done in the primary care setting, as well as what I would do, and of course, treatment options. So a lot of times patients will come to see us and they have urinary complaints and associated with pain. And they're very common and they can be somewhat frustrating, but some of the most common cases that are seen are people who present to your clinic and they say, well, it hurts when I pee, or I feel like I have a urinary tract infection. I don't feel that I'm emptying my bladder all the way. I just urinated and it feels like I have to go again, or I have to go all the time. Particularly at night when I lay in bed, I feel like there's something in my bladder. I have pain in my urethra, or a sensation that there's something at the tip of the penis, and it feels like I'm having a period even though I don't have a uterus. So based on these symptoms, these are the cases that patients will present to you with this complaint. And this is a list of differential diagnoses for urologic source for pelvic pain. This is a very large list, and unfortunately, it is not all encompassing, but these are the most common things that you're going to see in your practice, and these are the things that I would like to go over today. So hands down, the most common thing that we see when patients come into our office with an associated symptom of pain in their bladder is a urinary tract infection. So oftentimes it's fairly straightforward. The patient will come in, they'll say it burns when I pee, you'll get a urine sample, it'll be abnormal, you'll give the patient antibiotics and the symptoms go away. But sometimes it's not so clear cut. And so what happens is they come in, they say they took the antibiotics, but their symptoms either got better and then came back or they never went away at all. And then what you really need to ask yourself is it really a urinary tract infection? And so in this patient case, what you would do is, of course, check a urinalysis. And so all of us do a urine sample in our office, and sometimes we just do a dipstick and treat based on that. And what I would caution you is you need to be careful about diagnosing and treating a UTI based on a dipstick, because the dipstick can be falsely positive. For example, if the patient has taken phenazopyridine, which is over-the-counter AZO, which is a common medication to help with bladder pain, the urine dipstick can show false positive for nitrites, and then we can assume that there's an infection based on that, and we give antibiotics without actually getting a culture. So it's really important that when the patient comes in and you get a urine sample, that you actually get a culture, particularly if you suspect an infection. And there's a couple different ways to order this, particularly on Epic. There's a urinalysis culture if indicated, but what I would recommend is that you actually just order a straightforward culture, because when patients come in, the urinalysis may not necessarily be abnormal, and it doesn't meet the criteria to reflex to a culture. So it's really important that you actually culture the urine, not culture if indicated. The other thing that's important is that you get an appropriate specimen. So oftentimes we've all seen this where patients come into our office and they have symptoms of UTI and they give a urine sample and you do culture it and it comes back showing mixed organisms. And if the patient is asymptomatic, it's reasonable to expect that this is just a contamination and there's no infection. However, if the patient is symptomatic and they have mixed organisms, you really need to make sure that this specimen was collected correctly, because it can be that there is some infection somewhere in there, but the bacteria is just not able to be identified because of the cross-contamination. So I always try to educate my patients on the appropriate method of obtaining a specimen. You'd be surprised how many patients come in and they've obtained the specimen either from a bedpan or from a commode that's never been cleaned. I've sometimes had patients that have obtained the urine out of the toilet after they've peed into the water. And obviously, that's going to give you an inaccurate culture. The other thing that you need to instruct the patient is the...
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.